How do prophylactic antibiotics prevent recurrent UTIs? Imagine a way to keep urinary tract infections from happening over and over again. That's what prophylactic antibiotics aim to do. They are used to prevent recurrent urinary tract infections by maintaining a steady level of medication in the body. This approach is especially helpful for people who experience frequent infections that disrupt daily life. The idea is to keep bacteria from growing enough to cause symptoms, rather than waiting for an infection to develop. Prophylactic antibiotics work by exposing the urinary tract to a low dose of antibiotics regularly. This continuous, gentle exposure helps suppress bacteria that often cause urinary tract infections, like Escherichia coli. Common antibiotics used for this purpose include nitrofurantoin, trimethoprim combined with sulfamethoxazole, and trimethoprim alone. These medications are chosen because they are effective at preventing bacterial growth without causing significant side effects for most people. The benefits of using prophylactic antibiotics are clear. Many studies show that they can significantly lower the number of infections during treatment. This can be a relief for people who suffer from frequent UTIs, helping them avoid discomfort and the need for repeated antibiotic courses. Patients often report feeling more confident and satisfied when their symptoms are better controlled, and their quality of life improves. However, there are important considerations to keep in mind. One major concern is antibiotic resistance. When antibiotics are used long-term, bacteria can adapt and become resistant, making future infections harder to treat. Side effects are also possible, including stomach upset, skin rashes, and, in rare cases, more serious issues like liver or lung problems. Additionally, once the antibiotics are stopped, the risk of UTIs returning usually goes back to the original level, meaning prophylaxis doesn't change the underlying susceptibility to infections. For those worried about resistance or side effects, alternatives exist. One such option is methenamine hippurate, which releases formaldehyde in acidic urine to inhibit bacteria. It has been shown to be as effective as antibiotics in preventing UTIs and offers a different mechanism that might reduce the risk of resistance. In the context of bladder health and bladder cancer, preventing recurrent UTIs is important because infections can sometimes cause irritation or inflammation that may influence bladder health over time. Managing UTIs effectively with antibiotics can help prevent complications, but it's essential to work closely with a healthcare provider. They can help weigh the benefits and risks, and suggest personalized strategies to keep your bladder healthy. Regular checkups, proper hygiene, and tailored treatment plans are key to maintaining good bladder health and reducing the risk of recurrent infections.